Scarborough Hospital is a two-sided hospital in a very diverse community. We are very unique in that.
Here at the Scarborough Hospital, MedRec has always been a challenge. And the reason why it's been a challenge is because we serve a culturally diverse and global community. And there's numerous languages.
We provide nephrology care to approximately 700 patients with end-stage renal disease. Those disorders, in addition to kidney disease, can give rise to multiple other systemic problems. And as a result, they need a lot of medications. They need a lot of meds to manage their multiple conditions. And so these generally are very complex patients.
So why do we need to complete a medication reconciliation? It really is to improve patient safety and prevent medication errors. Research has demonstrated that medication reconciliation at admission has led to a 43% reduction in all adverse drug events caused by errors. And this is important to us as it is important to all patients.
Here in the oncology clinic at the Scarborough Hospital, we have become quite innovative in terms of our electronic use. One of the key areas is the recording of patients' home medications. We use a software called Iatrix to input patients' home medications, and that is tied directly into the patient's Meditech electronic chart. When a pharmacist in the oncology clinic first meets with a patient, we have a list of the medications that the patient was taking at home that's been collected by the nurse. They would have entered it into our electronic MedRec software, which is available at every terminal.
So as a nurse, one of the things that I find very helpful in having med reconciliation is that a patient's medication list is always up to date and current, so that if you have any questions about what the patient's taking, you know that you can go to that medication reconciliation in the computer and find out what the patient's taking. We take a very in-depth look at the patient's medications, and we chart those onto the computer. Once the patient started their chemotherapy, then of course we have to update that to keep it current at all times.
We've successfully completed admission and discharge medication reconciliation throughout the entire hospital. To date, we are at about a 90% completion of actually having the medication history form completed, and then 85% where the prescriber has signed that off. So we're really pleased with our results thus far.
In terms of electronic medication reconciliation, we have come a long way from where we started, being all paper-based. So far, we use the ODB drug profile viewer to get a baseline list for patients' home medications. We generate transfer orders from Meditech, and we generate discharge prescriptions from Meditech also.
Our technicians play a very important role in our medication reconciliation process at Scarborough Hospital. We're very fortunate to have over 50% of our technicians registered by the Ontario College of Pharmacists, and we're very proud of them.
When patients come to a pre-admit lab, as a pharmacy technician, I usually ask the patients about their allergies, and then I ask them about what medications they're currently taking, any medications over the counter, and herbal medications. We usually record them in a medication history form.
So some of our future directions is to be able to work with our Innovation and Performance Improvement Office, and we're planning to review our current system of medication reconciliation, which uses a combination of paper and electronic processes, and really have a long-term vision of using electronic medication reconciliation process.
We have a great opportunity with med reconciliation to really focus in on health and wellness. Med reconciliation is not just having the numbers and the names of the medications that people are on. It's the opportunity to work with individuals to help them take charge of their lives. So to me, this is the innovation around med reconciliation. The other part of it is making it electronic. We are moving in that direction. We have some of that already in place. This is all around patient care. This is all around safety. This is all around communication. And with our community, we can't stress enough why that is so crucial. So these are my visions for patient care and med reconciliation.